Just to welcome you to all our participants and all our presenters to this second webinar on the theme of Our Sisters, Our Future, Health and Spiritual Care for Aging. And this is an important initiative, and I'll say a little bit more about it. But we'll begin with the prayer led by Sister Marie Douve, who will be leading us in French.
Avec grâce.
Aging gracefully. How to care for aging nuns.
Assemblés pour réfléchir.
Gathered to reflect on the grace of getting old and how to care for the elderly nuns. We want to entrust our assembly to the Lord, who is the source and the completion of all our activities. Let us invoke the Spirit of God upon our congregations, our sisters, and our people. May He lead us with His wisdom, enlighten us with His understanding, guide us with His counsels, and strengthen us with His strength, and instill in us fear and adoration. Come, Holy Spirit, into our hearts, and send from heaven a ray of your light. Wash what is unclean, bathe what is dry, make what is stiff, warm what is cold, make straight what is crooked. To those who have faith and trust in you, give your 7 sacred gifts, give merit and virtue, give eternal joy. St. Luke in his Gospel presents us with the figure of 2 elderly people, Simon and Anna. He received the child in his arms and blessed God, saying, "Now, O Master, you may let your servant go in peace, according to your word. For my eyes have seen the salvation which you have prepared before the people, a light which reveals itself to the nations and gives glory to your people Israel." There was also a woman, a prophet, Anna, daughter of Phanuel, of the tribe of Asher. She was very advanced in age. Coming at that very hour, she proclaimed the praises of God and spoke to the child, to all those who were waiting for the deliverance of Jerusalem. The elderly sisters of our different congregations resemble Simon and Anne. All their lives they have witnessed to Christ and allowed the Holy Spirit to lead them. They have been witnesses to the fidelity of God, who has never abandoned them. Their lives were filled with the love of Christ, who was a light for them. They need our love and affection. They need our attention and our service. To give thanks to God every day like Hannah, and to exclaim like Simon when the Lord comes to take them with him, Now, O Master, you may let your servant go in peace according to your word.
Donc, avoir
Let us know how to have the same look as God on the elderly, who, far from being useless, are bearers of spiritual experience, witnesses of God's fidelity and of openness to the Spirit. Let us give thanks to God, who also evangelizes us through the elderly of our communities.
Seigneur dit à chacune d'elles,
The Lord said to each of them in these words addressed to the people of Israel, "Until your old age, I will be the same. I will sustain you. I have done it, and I still want to carry you, to support you, and to save you. Yes, God, take care of the weak, the little ones, those who are without strength. Life is a gift from God, and growing old is a crown for the just. Long life
car elle est promise à qui honore ses parents. Le juste a la joie de voir les enfants de
way of
ses
seeing his children's children. And like Abraham, full of days, he can die in peace after a full day. Yes, growing old is a grace, a chance to renew one's capacity to love. Lord, we thank you for the gift
le don de la vie. Te rendons grâce avec nos sœurs Angie. Nous te regardons avec joie, tendresse, miséricorde, action de grâce. Elles sont aussi le temps pour l'amour.
a concrete sign of your love for our religious families. They are signs of your love, of your tenderness, of your goodness, by the tenderness that springs from their eyes, from their weakened gestures, from their fragile strength. Lord Jesus, fill us with compassion to take care of our elderly sisters.
Sois une source de bénédiction. Un proverbe africain ne dit-il pas ceci? Les enfants sont le bâton de la vieillesse. Aide-nous, Seigneur, à être le bâton, l'épaule sur laquelle nos frères âgés peuvent prendre appui pour marcher avec joie à la rencontre du Christ et entrer dans le bonheur éternel. Amen.
Walk with you to meet Christ.
Thank you very much, Sister Mary, for that very moving prayer, where you presented us with the images of Simeon and Anna as the images of all our sisters who are aging, who are witnesses to Christ and witnesses to the fidelity of God. And you remind us that growing old is a grace, and that we're called to compassion and tenderness. Thank you very much indeed. Thank you. My name is Sister Pat Murray, and I'm the Executive Secretary of the International Union of Superiors General. And it's my joy today to begin this important second webinar on health and spiritual care for aging. This is a collaborative initiative with the Conrad N. Hilton Foundation, because the foundation is seeking to determine the needs of congregations now and into the future with regard to the matter of aging and sisters who are aging. I want to thank you for your participation during this first day of Holy Week, because I know how busy many of you are. But it's important, your participation here, because it will help the foundation to be guided by your feedback on how to use funding for the future. So our webinar today is divided into several parts. First of all, Father Tom Gaunt will provide feedback from our first webinar. Then we will have two panels from different voices from different parts of the world, looking at the challenges and solutions, as well as the funding and the housing needs for our care of elderly sisters. And finally, we'll have some time for questions and discussion, and an important survey for you to fill up at the end of this meeting, which will provide future guidance for the Hilton Foundation. And the last step, Sister Jane will sum up and look at the key points and the next steps that are ahead for us to take. So we will begin by inviting Father Tom Gaunt, who will give us the results of the survey which we undertook at the end of the last webinar. Father Tom is a Jesuit of the Eastern Province in the United States of America. He has many qualifications, too long to list, but just to say he's currently the executive director at CARA. And before that, he was the executive secretary or the associate of the Jesuit Conference USA, which was the national office of the Jesuits of the United States. And he was in that role for 9 years. He has been director of formation and studies, and a pastor and a director of planning and research in the Diocese of Charlotte for 10 years. Father Tom has many publications, and I would just alert you that there's a forthcoming publication, which we look forward to seeing, called New Faces, New Possibilities, Cultural Diversity and Structural Change in Institutes of Women Religious. And that's due to be published this April by Liturgical Press. So it's something that concerns us all, and I know will be of great help to us. Father Tom, over to you.
Thank you very much, Sister. I just want to check, is the screen up on the presentation? Very good. So thank you very much. At our last webinar a month ago, we had the survey at the end asking what were some of the critical issues that major superiors were facing in regard to the care and support of elderly or infirm sisters. So we had more than 400 responses from all regions of the world from that webinar. It's not switching. These major issues, we went through all of the 400 responses, reviewed them, and tried to organize them into 7 broad themes or categories. The first 2 themes really focus in the area of accompaniment, and then about 4 more themes that came under the area of planning for physical needs, and then a 7th final theme that was rather unique for us. This first item that came up was on providing ongoing formation for the aging. And here, as we identify a couple of the quotes that sisters wrote in, that it's fundamentally just the challenge or difficulty of dealing with the issue of aging, that there's a certain fear or hesitancy about talking about aging and the challenges that come with that. So we find across the board, people find it difficult to accept old age, but also difficult to find meaning in their mission as they get older. There's also a need here that was expressed for ongoing formation in the area of mental health and the effects of aging on the community. You can see this was one concern expressed from Australia. There's also expressed a lack of a retirement culture. And this is the sense that somehow we must constantly be working and active until the day we go to the Lord. And the need for people to recognize as we're getting older, we need to slow down, we need to shift how we do things, and that this is okay. It's all right to be a little slower or a little more quiet as we get older. The second theme was on the need to train younger members to accompany elder sisters spiritually, psychologically, emotionally. And so we see here the expressed, the first one coming from South America, the need to accompany elderly sisters spiritually through their lifetime, especially in their final years. Helping younger sisters to value their elders and to educate them in the process of aging was a concern that came from Asia. And then just the accompaniment of sisters with the old, that those who are facing diminishment, being with them and assisting them. And the great challenge, and this came from Africa, the formation of younger members in this regard, of how to care for, respond to the needs of their elders. The third theme, and this focuses more on the physical need for facilities, the appropriate facilities for elderly care. So it was the challenge, and this came from Africa, is being able to continue to live their mission and their vocation in places where they are. If that's possible, it is good, but sometimes that is not possible, usually because of challenges on mobility and access in communities. And so the need of providing appropriate spaces, houses for elderly sisters, and especially providing formative programs for them. The needs of the elderly sister to be still intellectually engaged, spiritually engaged in the life and the mission of the community itself. There was expressed here a concern about the need for partnering with other facilities for placement, that often enough the needs of the elderly arise very quickly, and we need to be prepared for where will they go when we can't care for them within our own community buildings. And then managing the sisters' care as well as properties. And this is a situation where often enough the mother house is just not properly designed for the care of the elderly or infirm, or that the buildings, the facilities themselves are way too large for the numbers who are involved. A fourth area was the need for sufficient financial resources. So from North America came that the aging communities without financial resources have great strains and demands placed upon them. And this highlighted the need or desire that superiors had, that they wish they had planned more years ago for their current future. The inadequate finances and personnel to cater for the needs of aging members expressed from sisters in South America. The issue of healthcare, that the lack of health insurance policies were brought up by sisters in Asia. And here this would apply to a number of places, but it was spoken of from sisters in Africa, that the elderly sisters who were from Europe or North America, they have returned home as they got older. But now the challenge is that the local sisters, who are generally younger, but need to be planning for their own health care and support as they get older. So it's the need for access to medical care that's important, and the financial planning and resources to make that possible. Another major area was simply the increase in elderly members and the decrease in younger members. This is particularly acute in North America and Europe. And so it's sort of turning things upside down when you have a situation that the majority of sisters or members are quite elderly and infirm, and there are very few younger ones. And so the great demands that are placed upon the younger ones, and just the distress that some of the elderly sisters have just in how their needs are going to be met or responded to. Some of this issue creates a difficulty that there's a hesitancy to talk about the aging and our own fears and our own needs for companionship as we get older. It's also, again, balancing the multiple dimensions of healthcare. There are the physical dimensions. There's also the spiritual, emotional, intellectual dimensions of this, and relationships to family and friends as we get older. A particular concern highlighted a number of times was the loneliness of elderly sisters, that they can find themselves simply separated from so much activity and engagement, that that sense of loneliness, of being by themselves or not a part of the community's mission, becomes a very serious issue. Long-term planning for elderly care was also identified. And so from South America, we heard that we need to create a structure to welcome elderly and sick sisters. We need to be thinking ahead so that we have something set up and prepared. There's also the planning needs for a retirement unit, even for communities that are much younger and are very busy about their ministries, but need to be looking ahead in the next 10 or 20 years. Another community mentions that the need to make sure that they're improving their facilities so that in 5, 10 years from now, they're able to manage elderly sisters and they have the financial resources to do that. And again, the emphasis from the community in Asia, the long-term planning needs to prepare to be able to care for elderly members. Then this seventh issue, which is that there was a small number, but a number of sisters came back and said that the need to address and plan for the aging is still quite distant for them because their membership is quite young and this is not their immediate focus, but are also recognizing that they should be thinking ahead, again, 10, 20 years to pay attention. On another side of that was the comment from a North American sister that over the years, their congregation has created a fund for elderly sisters, and they have a house and facility dedicated to them, so that today, currently, there is no particular problem. This would be unusual, a little more exceptional, but it's the testimony that those who are planning ahead and trying to put their facilities and their finances in order are now, when they are confronted with many elderly sisters, are in a very good position. And then finally, one sister from South America commented that we still do not have elderly women as part of the community. So that again, this is still a somewhat distant issue that they're looking at. So what we found in these 400 or more comments that came in, and they came from every section of the world, we found the common themes and issues that come up regardless of where sisters are in the world. And these are kind of feeding into or informing us in terms of what are next steps and how we should go from here. So the program is set. We have 2 upcoming panels to discuss these issues about accompaniment that were raised by so many sisters, and the issues and concerns about planning for the physical needs and the financial resources of the community. Sister Pat, I turn it back to you.
Thank you very much, Father Tom, because in a sense you have set the context in which the next 2 panels are going to speak about the challenges and the solutions, and also planning for physical needs into the future. Thank you for that very composite overview of those many responses. It certainly gives each of us something to look at. It's like a template in which to examine our own congregation and our own provinces or our own local reality and see where we actually stand ourselves. Now I'm going to introduce the next panel as I'm moderating it. We have 3 panelists. Sister Rosa Gutierrez, who's a member of the Hermanas Hospitalarias, which is the sister hospitalers of the Sacred Heart of Jesus. She's from Spain, and she currently serves on the Provincial Council in Spain and is responsible for the residence of elderly sisters. The charism of the congregation is the charism of hospitality. The sisters want to shape a world where the sick and elderly are no longer marginalized, but receive the respect and care they need. I'm going to give you 7 minutes, sister, to speak, and I will be strict on time so that we can hear the other 2 panelists. You're most welcome, Sister Rosa.
Hermana Rosa, necesita...
Good morning. You need to unmute, please.
Yeah.
Okay, go ahead. Good morning. Greetings to all of you. First and foremost, I'd like to thank the UISG and all the people behind the organization of this webinar. Thank you, Sister Pat, for accompanying us as a moderator in our journey together as congregations, and a big thank you to Sister Anabela Carneiro, my Superior General, for inviting me and for giving me this opportunity to participate in this meeting, tackling this important theme. So the theme is how to accompany the process of aging, the aging process of our sisters. Let me start reminding us the invitation of Pope Francis on the first day of the elderly to reconsider and value the elderly, their life experience as well as their faith, because a people that doesn't treat well its elderly, it is a people without future. We are called to value them, to value their life experience. The aging process of the population is a reality, is a fact in many countries. with a high life expectancy. The religious have a common element. Together with aging, there are physical, cognitive limitations, just like any other member of our societies. However, our elderly sisters have something different that we need to consider when we are called to accompany these processes. That is the sense of duty, which is within themselves as consecrated women, despite aging and limitations. They go on due to this sense of duty. And so we are called to take care of them. The importance of accompaniment in this process, to do it in a progressive way, when these limitations start appearing, means that we need to pave the way to accompany the elderly members of our congregations from their home to a new residence. We tried to elaborate a manual book for homes for the elderly in order to assist our elderly sisters in simplicity and harmony. It is not, to give them an additional burden. It is to rather accompany them in this stage of their lives. In order to favor this transition, we are organizing according to, the age groups, because they do not have all the same needs and the same necessities. There are very old sisters who are very autonomous still, and that is not the same to another sister with great cognitive or physical limitations, and so they need a specific attention that can be very challenging. We organize them by level of dependency. So we have elderly sisters with some limitation, but with some degree of limitation, physical or cognitive, but who can still cooperate spiritually. And so they do not have a work, they do not have to work, they will assist spiritually, sharing their charism. And now there are just a few sisters who can accompany the elderly ones. So they are there to pass the charism of our congregation to the other collaborators. And then the medium and high dependency. That's where we have our residencies. We have 8 of them with professionals helping them from a physical, geriatrical, psychological, and spiritual point of view based on their own needs. And all this, as far as the organization is concerned. Another thing we're working on is the individualized attention. We try to support every sister based on her own needs, which can be very different from one sister to another. So we try to follow them individually. And the activities are important in order to accompany them in their aging in a healthy way. We're trying to slow this process down to the maximum extent. We try to involve them in leisure time there are communities devoting to this mission. Then there are two elements that have to do with our lives, to organize spaces for spiritual support and the participation in liturgical activities, as well as celebrations proper to religious life. A second element, our elderly sisters are very old, so spiritual and religious accompaniment is very important. And lastly, another element we mustn't forget is that we are aware that we need to earmark funds to involve professionals and always studying the best way to support our elderly sisters in order not to lose hope. And to conclude, I'd like to share with you some of the blessings that we have readapted to our sisters. Blessed are those people who make me feel loved, that I'm not alone, that I'm always an hospitalarian sister. Blessed those who welcome my first hours in the morning with a word of hope and a gesture of affection. Blessed those who are willing to repeat the words that I cannot catch. Blessed those who grant me some of their time smiling to share with me some of their time. Blessed those who do not show they're in a hurry when they see that my feet are very slow. And bless those who are so patient and treat me with much understanding and compassion, who see Jesus in me, the Good Samaritan, accompany me with his love. Bless those who take care of my needy body, those who remind me of the care of my own mother when I was a child. Blessed those who have granted me one more day of hospitalarian mission. Thank you very much.
Thank you very much, Sister Rosa, for ending with that beautiful prayer reflection, which is a reminder to us of how the small, kindly acts can really fill our lives, both as givers and receivers. Thank you also for pointing out that there are different levels of dependency and that individual attention is needed for our sisters who walk their own particular journey as they age. And you also outlined the need for spiritual, psychological, physical, and good leisure time to actually grow in fullness of life. Thank you for this opening intervention. We'll now move to listen to Sister Peter Lillian de Maria, who is a Carmelite sister for the aged and infirm. Sister Peter is the director of the Avila Institute of Gerontology. She has served her community in many administrative positions and has lectured widely on Alzheimer's disease, palliative care, geriatric spirituality. Sister Peter, I know, has developed successful dementia care programs, and over the past 15 years through the Avila Institute, she has worked with many congregations concerning aging issues. Sister Peter holds 3 state licenses as a nursing home administrator. So we look forward to your perspective, Sister Peter. Thank you very much.
Thank you, Sister Pat, and thank you so much for inviting me and being a part of such a wonderful group of women. I really know that the challenges out there are kind of scary for us at many times. And I think Father Tom outlined most of those challenges that each of us experience. You know, there are challenges, but there are solutions. And the solutions come when we start looking at how can we assess and educate our communities. The challenges are elders caring for elders now. All of a sudden, we look at each other and we say, how did we get so old so fast? We entered together in big groups, and that's what's happened. If you stand still in a community, you get 10 more jobs. We have less younger sisters behind us in some of our communities, and some are still flourishing with many younger sisters. So how do we balance the ministry and the caregiving together? How do we provide those safe environments? And how do we look at the needs of each sister, respecting their dignity? My father talked about, loneliness, and that is happening in many of our communities, and depression is happening in many of our communities. As leaders in communities, we feel like we need to do it all, but we have to remember that we can reach out to other people and form healthcare teams. And I'd like you to remember a word. Of course, it's an English word, very simple: eat. We all have to eat. But think of E, education; A, assessment; T, train. In education alone, understanding aging issues from all of our sisters, those who are aging and those who are accompanying them, is the solution to all of the things and the challenges, because each challenge brings an opportunity. One of the greatest differences between an elder's mind and a young person's mind is an elder's mind is filled with wisdom. So we cannot look at ourselves and say, well, I'm getting old, what use do I have? We have great use because of the experience that we have. So one of the things I knew that everyone is concerned about and the challenges has to do with dementia, and especially of the Alzheimer's type. Just think about the education that one can have learning more about Alzheimer's. I'm going to give you an opportunity to take a look at just one aspect of Alzheimer's. I want everybody to put their hands together like this. And what you're looking at right now is the size of your brain. Now, I know some of you might be disappointed. You wanted it to be bigger, but that's about the size of your brain. When learning about Alzheimer's education, we know that when information comes in to us, it comes in, it goes along our brain, it gets filed. And I can say to you, what time is lunch? It's 12 o'clock. I file it, it sticks. But a person who has Alzheimer's, there's tangles, there's these plaques that are forming. So the information comes in and it doesn't get to stick. So short-term memory is not there. So when a sister says, what time is mass? And you say, 11 o'clock. They say 11 o'clock, they walk away, they come back, what time is mass? I said 11 o'clock. They can't, because of the brain disease, they're unable to have that information stay with them. That one little issue, that one little understanding of Alzheimer's allows our younger sisters, allows those of us living with people who have dementia, are able to then accompany them to where they need to be in their disease. So when somebody says that a person has dementia, what the next question should be is, what is causing the dementia? There's over 60 causes to dementia. It could be a tumor and it could be Alzheimer's. You're going to treat someone who has Alzheimer's and use interventions differently than someone who may have a brain tumor. So education is key. Knowledge is power. So the more that we can learn about aging issues, the better it is. Proper assessments, looking at the age of our community, the health of our community, so we can kind of proactively look at what are we going to need as the future goes? What areas of skilled care are we going to need because of the sisters that we have? What areas of assisted living will we need? And I think most importantly is that we take a look at and understand our own fear of aging. Many times we look, And we say, well, I don't know. I don't want to be dependent on somebody. Many of us all say that. So our aging sisters are all saying that as well. To understand those independence to dependence, what do we do? How do we accompany those people and those sisters that are in such need at that time? So who needs this education? Those living with the diagnosis of dementia, those living with aging issues, those who live alongside people. For instance, in Alzheimer's, communication is the key. So how do we communicate with someone who has Alzheimer's disease? All our caregivers and our staff need education. But again, we don't do this alone. It's extremely important to form a healthcare team in each of our communities, someone who is maybe a nurse, spiritual care person, a social worker, who can help the leadership make decisions based on the assessments that the healthcare team could be making of the entire community, so that they can look at appropriate living spaces, using proper assessment tools, and then providing ongoing education. Palliative care is extremely important, so that we are looking at the emotional needs, the spiritual needs, the congregational needs of our communities, as we look at each individual and look at their dignity and help them to see that they continue to have purpose, and their gift in life is extremely important to each of us. So
one more minute, Sister Peter.
So ongoing education is important. Support groups are important. Support groups within your community. Support group within, your not only your community, but amongst your leadership. And understanding that there are several best practices that are out there that we can share together in our accompanying our aging sisters. So education, assessment, and proper training and skills for all our healthcare teams.
Thank you very much, Sister Peter. I don't think we will forget eat. That's a lovely phrase to hang what you've said and to repeat to ourselves, to educate, to assess, to train. And, you, in many cases, as you said at the beginning, we're aging together. And that's the challenge, but we also need the skilled care and the assisted living, both facilities and people who can assist our living into the future. Because as you reminded us, we're on this journey from independence to dependence. There are many steps to take along the way. Thank you very much for your insight and wisdom. And now we'll move to the third speaker of this panel, Sister Anne-Marie Grafton, who's a religious of the Sisters of Providence of La Pommeraye, a congregation of French origin and of Carmelite spirituality. They're present in 8 countries. And Sister Anne-Marie has served in formation in her congregation, in juniorate and novitiate, and has also been the regional person in France and Madagascar. Currently, Anne-Marie is the Secretary General of COREF, which is the Conference of Male and Female Religious of France. And she has particular responsibility for the Commission of COREF, which is serving older sisters and brothers and initial formation commissions. She was a primary school teacher for over 20 years. Sister Anne-Marie is going to bring the perspective of a conference of religious to our reflection today. So we welcome you, Anne-Marie. Thank you.
Bonjour à tous, à toutes.
Good morning to each one of you. Thank you very much for your invitation. I'm going to echo what is happening in France to support and sustain the institutes and to accompany elderly. I'm going to divide my talk in 3 parts. The first one to talk about the past and what happened towards the future. And what is happening now, the efforts to respond to our needs, and in the end about the sessions. So since 2000 in France, the conference had a commission that is entitled Services, Health Services, that was established to support and sustain elderly sisters and brothers. There's another group in France that is called Religious in the Pastoral Health. So for 40 years now, seminars and formations were proposed. The COREF worked a lot with this other group in the health field. The other commission had to stop because of its elderly members, and the Conference of Religious of France, the COREF, and since it became COREF, continued this work and took up the responsibilities of the other commission. It's about 7, 8, 9 members who meet 4 times a year. And the objective is to take into considerations the questions that face the major superiors in accompanying elderly nuns, and also to talk about the attention of lay people who are in charge of accompanying them. So it's about taking in charge spiritually, and the conference also provides sessions of formations in order to answer the needs that are highlighted by the many congregations. The National Federation of Health Institutes and Social Activities of Christian Intention collaborates with the COREF. So they work with foundations, institutes, several entities in order to protect the Christian spirit. A lot of congregations were helped to find solutions to adapt their properties and their houses to welcome and accompany elderly people, elderly nuns. Several ways of taking care were put in act. So we had the mother houses, then the retreat houses, and then other structures. These establishments were created in strict collaboration with other agencies, governmental agencies, to provide health support. These structures have advantages and inconveniences. They have subventions and financial aid from the government, but they are also very limited in number of beds, openness to laypersons, and a maximum capacity of accepting people, and sometimes taking personnel that is not adapted or very quickly chosen. For more than 40 years, the association founded a house for mixed religious. Sometimes certain floors of that structure are dedicated per congregation in order to help them keep up their spirituality. They are also, of course, divided according to people who are dependent, according to their level of independence. Other institutes found other ways to take care of their elderly sisters and brothers of other levels of independency, maybe those who are in need of daily assistance. So aside from these establishments that are in collaboration with the governmental entities, we also created what we call intermediate houses, and they usually regroup 10, 15, 20, 25 members that can allow help for laundry, meals, administrative support, and the life of communities in these places is accompanied. They face difficulties finding responsible of communities. It's a social question today with regard to the number of those institutes in France. It is not about bringing wellness to the daily life of the personnel in these places, but also to provide spiritual supports. In addition to the responsible of the houses, governors, we see another profile of lay assistant in the communities. This role is really different. During the sessions, we tried to define the profile of these assistants in communities. Indeed, it's a responsible in the community that works with a referent person, religious from the institute. This person has a lot of autonomy. For instance, for the health institute establishments, she can take care of a family on the floor, so she follows all the appointments for all sorts of accompaniment of religious men and women, and keep the relation with the administration, spiritual follow-up, activities, inter-community activities. Some lay persons are full-time with the groups in charge of animation. Other responsible are work solo. So the steps are made little by little in order to be helpful, in order to assist a large number of sisters at this elderly age. We do recognize that we need to hire more personnel.
1 minute,
future.
Sister Anne. 1 minute.
You still have 1 minute? So for 20 years now, so we had like formation sessions to learn how to live as elderly, to keep a significant elderly life. What is the mission of the communities to take care of elderly sisters? What spiritual animation in these structures that are to receive the elderly sisters? And getting old in times of confinement and pandemic. And our next session would be how to live in steps and how to live the transition. Each formation session allows participants to exchange, to share witnesses and experiences, and according to the theme, we come up with reports and individual sheets that then we share with all the religious institutes. For instance, how to prepare oneself in the community to welcome a new member, how to celebrate in the community in an adapted way to engage elderly, how to celebrate arrival and departure with all the sisters that are there, and to ensure the service of community. What criteria and what reference? I thank you for your attention.
Thank you very much, Anne-Marie. I think I'm in amazement at the fact that for 40 years, COREF has been doing this work, in a sense, preparing congregations, looking at very practical things like housing, but also at the spiritual needs and also at the kind of formation and information needed by leaders of congregations. I think it really strikes me too that you have been fortunate to have the collaboration with different entities who care for health and health from a Christian Catholic perspective, as well as practical help from the government. It's very interesting. I think you raised the question for us of what conferences of religious can do in order to support superiors general. Thank you very much. not only superiors general, but also leaders at provincial level, regional level. I'm going to invite those of you listening, if you have questions, please write your questions in the chat. We'll take a stretch break for 3 minutes before we begin the next panel. So it's now 3 minutes past the hour. So we will reconvene at 6 minutes past the hour, wherever you are in the world. So just take a stretch break for 3 minutes and we will come back together again. Thank you. Now, welcome back. I just have 1 or 2 announcements. First of all, we don't see Sister Judy Donovan, CSJ, online. And maybe, Sister Judy, you are using another name, or you're there in another capacity. So just please alert us if you are there.
I'm here and my name is up. Hello.
Hello.
Yeah.
That's fine. That's good to know. When we call on you, you'll come forward. We were looking for you. The second is, people have asked, will the texts be available? So I would ask each of the presenters to send your text to me. And I will put my email in the chat. So there are many comments to say that these interventions have been most helpful. Now I'm going to hand the next session over to Sister Carol Zinn, who's a sister of St. Joseph from Philadelphia, and who is currently the executive director of the Leadership Conference of Women Religious. Sister Carol has a very extensive CV. She has taught at many levels, has worked in educational and congregational leadership. She has a Bachelor of Science in Education, a Master's in Theology, and a doctorate in curriculum development. In addition, Sister Carol has represented the Sisters of St. Joseph at the United Nations, and she has worked with several consultancy groups in terms of the management of change and also accompanying religious orders. Sister Carol, I hand to you for this next panel. Thank you very much indeed.
Thanks very much, Sister Pat. Happy to be part of this really very helpful conversation. I am honored to introduce the three panelists who will speak with each other today. The topic for this panel is kind of the nuts and bolts, as we say, talking about facilities and finances and planning and collaboration. So I'm happy to introduce to you the three panelists, and then we'll begin our conversation. Mother Mary Claudia comes to us from the Anambra State in Nigeria. She is presently the General Superior for her second term of the Sisters of the Immaculate Heart of Mary, Mother of Christ. Sister also has degrees in pastoral, youth pastoral, and catechesis from the University in Rome, and also the Salesian University in Rome. And we are delighted that she will share with us her vast experience from working in her congregation with postulants and novices and youth, and now in her second term as General Superior. We also welcome Sister Ignacia Nabel. Sister is from the Philippines, and she's a religious with the Franciscan Sisters of the Immaculate Conception of the Holy Mother of God. Sister Ignacia holds a bachelor's and master's degree in science and nursing, as well as a doctorate. She has served in multiple roles, from bedside nurse, nursing service director, college instructor, to the dean of nursing college, and later appointed the head of school. Sister currently serves as dean of the Institute of Nursing and a consultant in the care of elderly sisters. And we also welcome Sister Judith Donovan, who comes to us from the United States. Sister is a Sister of St. Joseph of Lyon, and she did pastoral work in Brazil and also several years community organizing in the US on the West Coast and in the Southwest. And for the past several years, she has served in community leadership. Sister Judy comes to us with education in psychology and philosophy and a master's degree in social work. Currently, Sister serves in her congregation's leadership and also as a consultant to the subcommittee on the Catholic Campaign for Human Development, Justice, Peace, and Human Development of the United States Conference of Catholic Bishops. So the three panelists are going to speak with each other, really, about the topics of planning for facilities, planning from the financial perspective, and how do we collaborate with each other. So, Sister Ignacia, I'd like to begin with you, please, if we might. Could you share with us some of the thoughts you have about the facilities that are needed as sisters age?
Good evening, good morning, sisters. I am honored to share some of my experiences as a caregiver of our elderly sisters. I am a Franciscan, as already introduced. I am a member of the Franciscan Sisters of the Immaculate Conception. Our congregation started in the Netherlands in 1844. Now in the Philippines, we are about 134 sisters only, and we lost 10 sisters during this COVID. We lost 10 sisters. Now, how did we start our work for the elderly sisters? Way back in 1980, we already started planning for our elderly sisters because we know that this is going to come with the increase of number of our elderly sisters. So as early as 1980, the board already started. And they gave me the opportunity to benchmark, to look into other congregations, how they do things, how they build their own nursing home. So in terms of structure, in terms of policies, in terms of guidelines. So I had that idea. So in 1984, we started our nursing home. First of all, our sister they were reluctant to go to the nursing home because the Filipino tradition is our elderly people just stay in the home. They are not uprooted from the family, and this is also a very Asian tradition. So our sister did not like, but while they are already settled in the communities, our sisters in the community cannot really take care of them because they have their own ministries. So we have to start somewhere, but finances is really the problem. So we have to ask assistance from our mother house. And our general superiors was very, very supportive. And so we were able to put up this facility for our sisters because we realized that all of us are aging and we need a space. We need a place where we can really be happy, joyful, and perhaps we will spend the rest of the remaining years of our life really in contentment and really with the Lord. So that was the very purpose of putting up this nursing home for our sisters. And we called it the powerhouse of the congregation because our elderly sisters are really, you see them in the chapel. They pray almost really every minute you see them there. So this is really a powerhouse of our congregation.
Sister, thank you so much. Mother Claudia, would you like to add what has your congregation done in terms of facilities for your senior sisters? Sister Claudia, are you there? Sister Judith, perhaps as we find, oh, there she is. Okay, hello.
Oh, hello.
Yes.
So I said, founded in 1937, of course, about 85 years now, we have many elderly sisters, about 34 or rather 48 of them are now in our elderly home. And just like the person who spoke before me, the planning started long ago, right from our 4th general chapter, and we're about to celebrate the 12th one. The congregation started planning about how to care for our elderly ones who are really the foundation members of our congregation. From that time on, we started, of course, saving for that. Saving because the finance is the problem, is the very big challenge for caring for the elderly people. We have what we call the welfare scheme for the sisters, right from the time they come in as postulants. Then a particular amount of money is being set apart for this particular caring during when someone has retired. And of course, the pension of the sisters who have really worked and are retired in this home are also kept aside for them. And in this way, we are able to construct the structure for these people because they cannot live comfortably in the convents where they had lived already or where others live. This is a special construction that we take into account the design to give space, the facilities, the handrail, the flooring that will not be slippery, and all other facilities that will make movement for them easy. Otherwise, we start getting casualties within the facility. And of course, constructed in such a way that they are also have to participate in the life of the community. Their rooms are connected to the chapel with audio so that when the mass is going on, those who cannot come out, they are also participating and everything they need to call attention whenever they have the need. The construction of the structure is not just the issue. The issue there is also to prepare for the human resources. And the human resources in terms of preparing the sisters who are specialized in geriatric nursing, those who know how to care for the elderly. Because these people, they no longer are able to help themselves and their mental and cognitive condition is no longer the same like the other. So we have our sisters who are trained in this area to care for them. And within the facility, we have a sick bay, we have a doctor resident there, one of our sisters, and we have also lay nurses that help these our sisters. Issues that cannot be handled in the sick bay is transferred to the nearby hospital, which is equally armed, where these stars are given more specialized care in order to, of course, keep them going. And we didn't stop there because these sisters, you find that they suffer from loneliness. They still have nostalgia for going out and for going to visit their homes. And so we have guidelines on how to manage that particular house. The guideline that really, guide the activities, the kind of diet that they are given, no longer what we eat in the other communities, their diet special one made. And then, of course, we allow the parents or the relations to come in from time to see them. And at other time, we also organize for them to go to their homes. They either come to visit them and take them along, or we do that by ourselves. So a lot is required to actually put up the physical structure for these elderly people, the management, which starts from planning when these sisters are coming in when they were still young, and then also the maintenance that we go on, of course, coming from the resources of the sisters who are actually engaged in the active ministries. From their salaries, amount is set apart also for this particular house because it is capital intensive, very capital intensive. What you give to the communities for their feeding and maintenance monthly, you double it for the elderly home because
Sister Claudia,
yeah.
Oh my goodness, such wonderful information, both from you and Sister Ignacia. Wonder if we could, Sister Judy, if you could speak to the facilities piece and the planning from a very different perspective in terms of smaller congregation, international congregation, please.
Sure. Good morning, everyone, or good evening. We are the former province of an international congregation. At our last general chapter, we moved to become canonically a house of the congregation. So, we used to be many and now we are few. And actually, other than myself, all of the other sisters are, technically seniors, elder. So what we did in the past with facilities, what we did in the past, like many North American congregations, we had our own nursing home with a sisters only unit. Then in the about 8 years ago, we transferred, we could no longer maintain, we no longer had sisters who could fully work in healthcare, et cetera. We transferred this nursing home to a Catholic healthcare system with an agreement that the sisters would always have a place, and we thought we were set. What we're doing now is that nursing home was sold last year to a for-profit entity. We were not pleased with that, but it was no longer ours. The former sisters only unit is now a co-ed unit, and the facility is definitely moving towards private pay rooms. So here in the US, we have a tax-funded assistance for the seniors called Medicare, but they're moving more and more towards private pay. So we right now are focused on getting the right expertise to help assist us and advise us on our best options. I consulted with other congregations, consulted with our leadership conference. We have now have a part-time healthcare coordinator. We have a part-time nurse's aide. So assisting us in advising us on our sisters' healthcare, since we have no one working in healthcare or administration anymore. And for our elderly sisters who are not yet in nursing care, we're focusing on making their communities safe for them to be able to stay as long as possible. That means putting in ramps or changing the bathrooms, changing the doorways, etc. What we need to do is plan for possible use of other facilities. We would love to be able to coordinate with another group of women religious, but we are in a rural state with few congregations, and all of them are in the same situation we are. The closest other religious community with a healthcare facility is 3 hours away. And so we're planning on either giving our sisters other options other than the nursing home that was, we ran for 70 years, either in our area, or if absolute need be, seeking beds in this facility run by another congregation, but that is at quite a distance.
Thank you very, very much, Sister Judy. Sisters, each of you have spoken about the facilities and a little bit about the finances needed in terms of the planning. Sister Ignacia, I wonder if we could come back to you. Could you say something about collaboration? Like we've heard from 3 of you now, and you each are doing some of this yourselves, but each of you also started to talk about doing it with other partners. Could you say something about collaboration?
Is in collaboration with rehabilitation center. This is as an institute, and they send their students to us, and they come 3 times a week to take care of our sisters, and the sisters love that. Another one is our alumni. Also, they go there regularly to play with the sisters, and the sisters love it. Of course, they also bring some goodies with them. So the alumni and this rehabilitation center and some other friends would come and give joy to our sisters. And that is what we are doing in terms of collaboration.
Thank you very much. Sister Claudia, collaboration with your senior sisters?
Yeah, we know, of course, here it is a special case. We are coming from the African perspective. The government do not have any agenda for the elderly as such, so everything is done by ourselves. But in terms of collaborating with other people, here the religious congregations do not really have elderly care homes. We have only 2 of them, our congregation and another one, of course, ours the biggest. And but in terms of collaboration, we know and we think that there will be need for that, because even as we are now, it is difficult for us to cope. So we collaborate with lay people who are assistant nurses. They come in to help and we pay them. But we know that to establish this home is a very capital intensive one, and not many congregations as of now will afford that. I think there wouldn't be any problem if those who already have, like ourselves, will be willing to open up collaboration with other congregations that perhaps will not be able to establish one. And there can be exchange of specialties. like in our congregation, if we don't have a psychologist who from time to time come in to consult with these elderly ones, a congregation that has that could offer us that service. And in terms of equally doctors, if we have more doctors, we can make available our own doctors to consult in other facilities or facility owned by congregations. In as much as, and those who don't have can bring theirs into ours. But we also envisage there could be a problem there because changing a sister from the environment that she has known so long with all that she has experienced into another one, it may be a problem. But then if that's the only option, I think it will be possible to do that. So for now, the collaboration there is not very outstanding in terms of having a common thing. But I know that religious congregations can also come together to, to plan for a home where congregations can send their elderly ones, especially those who don't have the number. In my congregation, we have at present 976 sisters, and the elderly ones are already 55 of them residing in the home. It may not be possible to, take them to another place except in our own facility that we have already planned for them. But those with smaller numbers can as well come in to be helped by all what we have.
Thank you so much.
So this
Sister.
is not yet happening, but I feel it's possible.
Yes, thank you so much. And Sister Judy, what about collaboration? We've heard from two congregations that have larger numbers, but what about the movement towards working with others?
Mother Mary Claudia, if we were closer, I'd be so happy to collaborate with you. I have reached out to the major superiors in our state to ask about their plans and their future to see, is there any possibility? We are planning, none of them have their mother houses here in Maine, in our state. They're all planning to either close or move their center closer to their mother houses. So we really cannot rely on that. So we are really looking at our both, like I said before, calling on our leadership conference nationally and our federation, the Federation of the Sisters of St. Joseph, that has many congregations with which a lot more expertise than we have, to see what they do. But looking here in Maine, in our state, to collaborate with nonprofit agencies who work with the elderly, and to really work together on the state of seniors in this state. Maine is a very rural and poor state, and in the United States, it has the highest per capita population of elderly of any state. So one way to collaborate is to advocate. We're really needing, with the very volatile politics in the United States, there is a very real danger that the public tax-funded support that does exist can be lost. And so advocating for protecting and not privatizing the senior care that does exist is one important way to collaborate here. And then building partnerships with people that we didn't have partnerships before, other non-religious, nonprofits and agencies that work with the elderly, and with hiring. We used to provide the workforce, and now we're hiring folks with expertise to help us.
Thanks very much, Sister Judy. Sisters, as we close this part of our session, we'd like to ask each of you if there was one piece of advice that you could give to the sisters who are listening right now. Only one piece of advice. What might that be? Sister Ignacia, could we start with you, please? I think you need to unmute yourself, sister.
Okay. I think my one piece of advice to our elderly is be yourself. Accept that we are all aging, and therefore that's going to help us. We are all aging, and we have to accept that. Don't deny that you are aging. That will be a healthy stand for all of us.
Thank you so much. Sister Mary Claude, what advice would you offer?
Yeah, my advice would be to all the congregations as well as the elderly, those who are elderly already. Aging is grace. We value them. They are the foundation of the congregation. They have a lot of wealth, and it goes with a lot of grace. They are really the powerhouse of congregations. In our own congregation, we give them what we call prayer apostolates. So they pray, they are very close to God. So my advice for them is to accept the situation as it is, and then know that the congregation loves them, and the younger ones come along, to make them feel that they still belong and we value what they have. And for all other congregations, whether we are still young, if we are young today, tomorrow will be old. So it is important to start on time to plan, set funds apart for the time when you will need to care for these elderly ones, because it is very challenging actually to care for them. It's capital intensive. So every congregation will have to start early to plan for that and to set funds apart. Whether you will have your own elderly home or you take them another place, you still need funding for that, except
Thank you very much. And Sister Judy,
help,
you have
but if it happens, the cost of the burden, the financial burden for that.
Thank you. Thank you so much, Sister. Sister Judy, a piece of advice.
One, planning never ends. Two, to be careful among ourselves that we do not think about ourselves as a workforce. We're not a workforce. We're women living a vocation with a mission that can be lived, whether you are running a school or a hospital, or whether you are greeting the CNA who comes in to help you with your hygiene in the morning. So that our mission has nothing to do with where we are living and how we are living. It's how we encounter the other, not what we do. And I think we have to be careful about that.
Sisters, thank you very much for just wonderful expertise on planning, on the kinds of facilities that really do help our sisters live their lives fully, the thinking that we need to do in order to plan ahead. And Sister Judy, I never heard that said before, that the planning never really ends. There's always another phase to the planning. So sisters, thank you so much for your witness and for your contribution. Sister Pat, back to you, please.
Thank you, Carol, and the wonderful panel for the very practical advice. I mean, I can hear plan, coordinate, collaborate, advocate as key words in the conversation, as well as re-echoing some of the things that were said earlier in terms of education, training, and assessment. One of the comments here says, we've got to work in networks. We have to share difficulties and help each other. And I think I'm hearing that from right across the globe. So I'm just going to offer some of the questions that have come in. And in some cases, I'll ask any of the panelists to respond. And I'll put out a few questions and let somebody take up what's of interest to them. So one question is, what is the profile and training of the lay assistants for communities of elderly? Another question is the whole question of limited financial resources. And I think that's echoing throughout all the presentations, that there's a need for financial resourcing, and there's a need to plan financial resources for a long time before the need is there. Someone asks, are there problems of collaboration between different bodies dealing with communities of elder people? How do we help sisters to accept that they need care? So the profile of lay assistants, financial resources, and really that's something that Hilton are looking at. Problems of collaboration between different bodies. And then how to help sisters to accept that they need extra care. So if anybody would like to reply to one or any of those questions, just signal and speak. Just open your mic and speak. Sister Peter, I see you.
Yes, I think the question about what are for the assistants, what would they need? First of all, certainly if they're working in and helping sisters who need more skilled care than nursing assistant, that type of clinical care. But the education around understanding the aging issues, from palliative care to geriatric aging issues, to dementia care, to geriatric spiritual care. So all of that training, and it doesn't have to be only at a university, it can be done through in-services and training from different institutes that provide that. So I think it's important to hook into those people who can provide that information.
Thank you, Sister Peter. That's one of the things I think that will be important for us and for the Hilton Foundation to identify the kinds of training that's out there that we can offer to congregations. Anne-Marie?
Oui. Nous, quand on a défini dans une session qui s'est faite en 3 fois avec des
When we identified in one session that we held 3 times, we said that the profile of that person is being responsible to be able to work in the community, to be able to assist each sister, to be engaged in the spiritual activity. The profile does not require to have specific formation in healthcare, but to be able to plan the needs of an individual in terms of meals, different services, different participation. So the responsibility of a community should have a religious sense, should know about community life, should be able to transmit the values, share in a community, work with the constitutions. So often we realize that most of them used to work in the spiritual assistance of hospitals, what we call them lay persons in ecclesiastical services in France. So they are specific people who help in hospitals and structures as such. So of course they accompanied approximately sisters. That's it. I don't know if I get anything else.
Thank you, Sister Anne-Marie. I'm going to ask a very specific question. Somebody asks if we would take a deep dive into how to work with the sister who wants to find meaning within the confines of their diminishment. So I'm going to address this to you, Sister Judy, because you've already raised the question of the essence of religious life being about our being rather than our doing.
Oh, wow. So in my former ministry, we used to say what we count counts. So if the only thing we count and recognize are sisters who are in paid ministry, or sisters who are running institutions, or sisters who are in an active ministry, then everyone gets the message that if you're not doing that, you don't count, or somehow your ministry is not. So in our group, once I entered leadership, that was the end of our salaries. We had no more income. We're living off our savings. So we started counting what everyone is doing. And so having conversations with sisters about, tell me how you live your mission today, in maybe how you get along with the person in the next bed, or How do you listen to the staff when they're frustrated? Or how do you welcome somebody new who's coming on your unit, and helping them open their eyes to the fact that the mission is everywhere. And particularly for sisters formed at a different time who really think that their mission ended when the school closed, for example, getting them to see that their mission, our charism, is unity and reconciliation, that they can live unity and reconciliation everywhere and in any state of life. So I think we have to count it. We have to recognize it. We have to tell those stories. We have to include it in our communication and our newsletters, and not just recognize those who are, out in the broader world doing something, but recognize the stories of those who are living their mission in their current state, whatever it may be.
Thank you very much, Judy. That's very helpful in the sense doing much more work, I think, around charism and identity really is called for, rather than translating it very quickly into action and active ministry only. There's a question here about the manual for residencies. Perhaps Sister Rosa, you could say something more about the manual, and there's a particular request, could it be shared with others? Because I think we need that kind of information.
Sí, nosotras.
Yes, we do have a guide that we developed a few years ago for residencies for these homes. How did we put that into practice? Well, we highlighted all the elements that are viable in order to plan for these homes. And the structure is common to all the homes. However, they're different from one another. We said not all the homes have to cater for the same needs. So we've tried to personalize, customize these homes, because each one of them needs to respond to specific needs. Then we also have community projects. There are sisters in the homes who participate in programs that are adapted to them, and there are professional people working with us, and we try to form them. We planned some formation days before the pandemic, and we are doing some other things online for those professionals who work in our homes.
Thank you very much. I mean, I think it's very important, the point that many of you have raised about the formation of lay personnel to accompany our sisters and accompany aging sisters. It's not always possible within the congregation to ask sisters who are in other ministries to also care for the elderly. So I think we have to think in a broader perspective, but to give the training and also to develop the profile of the lay assistants who would be working in communities. There's a comment here about the financial problems for congregations coming from the fact that sisters were not paid adequately within the church structures in the past in some parts of the world, but that now that is being repeated in other parts of the world, where dioceses expect sisters to volunteer in parishes or in parish institutions with little or no compensation, or not having the possibility to set money aside. And this is something that needs to be addressed. I would have to say that the UISG tries to address this question at the level of the Vatican, but this is something I think that also has to be addressed at the level of conferences of religious. There's a note in the chat that's worth looking at, that there's a longitudinal study on aging that was done in Ireland, and Sister Liz Murphy notes the work of Dr. Rose and Kenny. So really it's pointing to the fact that there are longitudinal studies done in different parts of the world that can help us as we move into the future. Just to see, is there anything else? Obviously, there's a question here in Africa where sisters are particularly young, and I'm sure it applies to parts of Asia and Latin America. How can congregations plan now for the aging of their members, especially as the financial means are sometimes lacking? So I think we're seeing the same comment coming up again. Planning for the future, but not having the means to plan. So I think at this stage, I will hand our reflection over to Sister Jane Wakahu for some final comments. No, excuse me, before I come to you, Sister Jane, I just want us to do the short survey that Sister Paula has prepared. Paula, if you would just say a little word on the survey. If you go to the chat, you will see the survey in different languages. Perhaps, Paula, you would like to add something. Yeah.
Thank you, Sister Pat. So for us as well to continue addressing the needs and the suggestions that you have, we've made a form, a survey, so it's on the chat in the different languages, in English, in French, in Spanish, in Italian. So if you can click that now, I believe we have some minutes to try to fill it in. And then we'll also send it again in the next email, people to respond to this survey alongside the registration form. Thank you very much.
Thank you, Paula. So we will take 5 minutes now at this stage to fill in the form. So click on your language, English, French, Spanish, or Italian, and please fill in the form. The questionnaire is in the chat. Sister Jean Schaefer. Stephens, the questionnaire is in the chat. And it will also be sent out after this webinar for you to complete if you have not done so. Sister Jane, may I ask you to give us some final words as we come to the end of this very interesting webinar?
Thank you so very much, Sister Pat, and thank you for all the presenters today and the conversations we have held. I'm Sister Jane Wakahio, a member of the Little Sisters of St. Francis. I come from Kenya, but I live in Los Angeles, working for the Conrad N. Hilton Foundation. And I'm so happy to also have my team here with us today. So I would say for these two webinars, we have listened and we have heard of the experiences from all the continents on the needs and desire to accompany each other. Our sisters, our future, health and spiritual care for aging sisters. Thank you to you all leaders who have been present and accompanying our sisters wherever you are and in whatever continent you're working in. If I would sum today's experience in the words of Jesus in Gospel of John 17, verse 12, I pray that they may all be one, just as you and I are one. And also Matthew 28:20, and remember that I am always with you until the end of time. Even as we discuss issues of our elderly care, God accompanies us, not just when we are vibrant and young, but also until the end of time. Listening to the speakers today from diverse backgrounds and continents, on the theme is common. There are common challenges and there are common opportunities, and we all can learn and take action. There are opportunities to collaborate are available, and I appreciate that we have sisters who have made plans for the care of elderly and are willing to share those experiences and even open the door to support others who may not have the similar resources and opportunities. I also recognize that each of us is on a journey, and all of us are on a journey. The only difference is that some are a few steps forward and others are following. That's why the Global Sisterhood calls us today in this conversation. And in the spirit of solidarity, communion, and participation, we are designing together the future we want to have. The future belongs to those who prepare for it, and where that future may look different in each continent or for each congregation. The Global Sisterhood provides us the opportunity to learn from those who are ahead and the methodologies they have used to address the question of elderly, beginning from the young all the way to the continuum of life. The journey we have walked together through these two webinars is helping us on a path of solidarity with each other. We from the Conrad N. Hilton Foundation is working with you. We want to be guided by your insights and feedback. So we invest in programs that support you and that support sisters, congregations, and conferences to explore meaningful ways to support members of the communities where you serve. So today I had a common theme that, like all human beings, at some point in life, we experience health, mobility, and cognitive decline, and that it is a moment of offering who we are to God. I heard of the need of accompanying sisters spiritually, young and old, for we are on this journey together. I heard of the needs for formation on the care of the elderly, both spiritually and intellectually, so that they remain engaged in the community. Formation to live together as elderly people. I heard of the need of facilities for elderly care, particularly those experiencing mobility and cognitive decline who may need specialized care and support. I heard of the need of management of sisters' properties and creating proper housing sizes that accommodate the needs of the sisters, those who had large convents and need to shrink them down. I have heard of the needs of financial resources is key to helping us to address the needs of elderly care sisters, in geriatric training, modifying facilities, and spiritual accompaniment. I heard of the needs of to access and educate our communities, balancing ministry and caregiving, looking at the needs of each sister because they are unique individual members of our communities, and providing their needs, not just as a group, but each individual sister to feel that they are cared and they are accompanied. I heard of the sisters who have formed healthcare teams and they are supporting each other through those healthcare teams in France. We want to learn more about that. I heard of EAT, education, assessment, and train. And that is a low-hanging fruit that we could easily be able to do and support our sisters. I've heard of those who have planned long-term, and already there's those facilities they have are providing the services they're needed for the sisters, and they are ready to open to bring other sisters into those spaces. And that is possible and can be facilitated. So what are the next steps from here? Based on our conversation with Cara, as Father Tom presented, Cara will be correcting the takeaway points of this webinar, just like Father Tom did at the beginning of the hour. And then they will work on a white paper that will be translated in different languages and be distributed to our conferences and congregations through the UISG in different languages, so that then we can continue this conversation and it does not end with it today. The conferences and congregations, we all need to reflect together. How are we providing the care to our elderly members, and how can we accompany them at the evening years of their life? The needs may be different in every continent, and the support may look quite differently. On the needs of the training, Sister Mary Peters explained very well of the Avila Institute that she manages and the approach they use on Alzheimer's care and other continuum of care. If you have sisters who are experienced or who have experience in any continent and you would like us to contact them, put the names in their chat or send them to Sister Pat, because one of the best steps we could begin is creating those teams at national or continental levels, those who can be tapped by other congregations to provide this type of trainings that could be of support to our elderly sisters and those who are working with the sisters. These are programs we could begin facilitating and supporting the sisters to get the skills, and those who are taking care of the sisters to get the skills that they need in order to provide meaningful care and supportive way for the sisters. Creating healthcare teams is possible, and this can be done quickly and sooner because the older sisters cannot wait. They need the care now, and we can be able to facilitate that as well. We have a beautiful experience shared by Sister Anne-Marie, 40 years of planning of COREF. We want to hear that learning and how it can be implemented in other areas. Although there could be differences with culture, but there is something we could harness from that particular experience. The next conversation will be on May 9th at the UISG meeting in Rome. From that meeting, we hope to come up with an action, because our ultimate goal as a foundation is to create a global fund where resources can be accessed by either conferences of congregations. But that is not something that happens in a day. It needs deep thinking, thoughtful way, experiences of women religious who have lived this life and who have worked like those who were in this panel today, so that then as we create this fund, we work on it meticulously so that it can be a resource to many congregations, to conferences, and those resources can reach to the sisters who need the support. That is just a global level. There could be more work that can be done at the national or at regional levels. As I mentioned in our last webinar, we are already conducting research in several countries on elderly care so that we may understand the magnitude of the need and the best approaches and recommendations we could utilize in making short-term, medium-term to long-term goals. Our hope is to create an international committee that could help sift all these conversations and create a solid plan for the next steps. We cannot do this as a foundation alone. We need you, sisters, because ultimately it is about you. It is about how to support our sisters. As leaders who are accompanying our sisters, we're gonna journey alongside you. And we are grateful to LCWR, to UISG, and all the members who presented today who have been accompanying us in this conversation. Through CARA, we are utilizing various data points. We are already conducting a research on adequately funded congregations here in the US. Those who at least planned a little bit ahead of time. How do they go through planning so that we can share those as best practices for the congregations that think of planning and that think of way they could start putting their resources together. Sisters, thank you so very much. Know that you are not alone and the foundation is working with you. And we hope to attract many more to come with us in order to support all of you in our care of elderly. We might not be able to provide for all the solutions, but as I said earlier, the future belongs to those who plan for it. We can begin with small steps and we will walk further in the coming years. Thank you very much and may God bless you all.
Thank you very much, Sister Jane, for those words of encouragement and also for giving us a sense of the thoughts of the foundation and of the collaboration that we are beginning and that will take us into the future. I just want to thank those who have shared with us today. Father Tom, Sister Rosa, Sister Peter Lillian, Sister Anne-Marie, Sister Mary Claude, Sister Ignatia, and Sister Judy. And also to thank Sister Carol Zinn for facilitating the second panel, and for Sister Marie Doof for leading us in prayer. And now we'll go to our closing prayer. I invite Sister Daniela Canavino to lead us in this prayer. But before she does so, I know some of you have had difficulty in submitting your survey. Please don't despair. It will be sent again to you after this meeting, and fill it in again, and we will collate all the results. It's lovely to see you, Daniela, most welcome, and to lead this prayer from South America. Grazie mille.
Muchas gracias. Bueno, buenos días o buenas tardes. Buenos días desde Colombia.
Thank you, and good morning, good afternoon. greetings to all of you on behalf of the Latin American and Caribbean Conference of Men and Women Religious. I'd like to invite you to conclude this gathering with a very simple prayer. Let's pray with a grateful heart. Life is a gift which in all its stages gives us wisdom in order to better live the years that we received by God. We need to contemplate the years with attention and vitality. In the light of what we have shared during this day, we are invited to cultivate the art of aging and to accept lucidly our vital rhythm. Let us dare to wait for what life puts in front of us, and at the same time prepare ourselves for the final encounter with confidence and gratitude. Everything is a gift. Let us take on our personal and community history, reconciled with our past, and let us fill our jars with the water of patience, knowing that God will surprise us with a good wine that flows from the great jar of his heart. And that heart, we live, we move, and we exist. And let us not forget to enter day by day the school of acceptance of our own limits with the effects of age. And let us help ourselves avoid any tendency to isolation and disinterest. Dear sisters, as religious life, always dedicated to small and great causes, let us keep a jovial spirit. Let us develop creativity and enjoy everything that life puts in front of us. May Mary, Mother of Jesus and our Mother, encourage us to be women full of life and to spread the life that is given to us and all around us. Amen.
Muchas gracias, Daniela.
Thank you, Daniela.
And thank you for reminding us that we have to learn the art of aging and that all is gift. Everything is gift. Thank you very much to all the participants, and you can open the microphones, Therese, so we can talk to each other across the world. Thank you very much indeed to everybody.